Namaste. I'm Dr. Siri V. Age is a most important factor when it comes to fertility. That is because everybody is born with a certain number of eggs. So, with every menstrual cycle, though one egg is released, there are multiple hundreds of eggs which die. So, as the age advances, the good amount of very good quality eggs would have already gone. So, with advanced age, there is the quality of the eggs that are remaining will be of a lower quality. And that too, after 35 years of age, there is a rapid decline in the number of eggs in the ovaries. So, at the age of 40, the incidence of pregnancy could be around just 3 to 5%. Again, it depends a lot on many of the factors, the racial factors, and also the health of the individual. So, there are many different factors which affect. So, number cannot be fixed, but definitely the fertility is much lower at the age of 40. At the age of 40 or any advanced maternal age, there is an added risk involved during pregnancy. That is the age related factors, like there could be hypertension, there is diabetes in pregnancy, there could be preterm pregnancy, and at the age of 40, nearly 25% of the pregnancies end up in abortion. That is because of the quality of the eggs, and there are chromosomal abnormalities that can occur in the baby with advanced maternal age group. So, with advancing age, definitely there is increased risk both at conception as well as during pregnancy. So, generally, we give a couple 1 year's time if they're having a regular intercourse, 1 year's time to to get conceived naturally. But with maternal age of 35 years and more, or people who are having irregular cycles, this 1 year norm is not to be considered. So they have to see a fertility expert much before that. So especially if the marriage has been a late marriage and they're planning for a pregnancy now at the age of 38 or 40, then definitely they shouldn't be taking a very long time because their fertility period is very short. And if they are not conceiving within 4 to 5 months, they have to see a fertility expert and take the help. There are several tests to analyze how the ovarian reserve is. So there's no particular test to know the egg quality unless we do an IVF procedure where we actually see the oocyte or the egg under the microscope and see there are different gradings as to how the eggs are. But AMH or Anti-Müllerian Hormone is one of the indicators where we use it to know what is the egg reserve in that woman. So if the AMH is low or very low, then we know we indirectly could say that the quality also would be low. And other fertility tests, like when we do an ultrasound, we do an antral follicle count, where in the second or the third day of the period, we count the number of follicles in the ovary. So that will give us a fair idea as to how the ovarian reserve is. And age being the most important factor. All these three together combined, we categorize women into 4 categories based on their age and their follicular number and their AMH values. And depending on that, we use different protocols for IVF stimulations or our fertility treatments further. Lifestyle, any age, not just 40, in any age group, having an active lifestyle, keeping yourself healthy, eating healthy, avoiding junk, not being obese, and not having any other medical conditions like hypertension or diabetes or hypothyroidism. These very well maintained parameters will definitely help in treatment of infertility, as well as complications of pregnancy can be avoided by maintaining a healthy lifestyle and a proper BMI and active lifestyle. Generally, infertility is defined as inability to conceive in spite of having regular intercourse for 1 year. So this is not mandatory as 1 year. If there is a woman who is more than 35 years, we call as advanced maternal age, or people who are having irregular cycles need to see their doctors much earlier to that, at even 5 to 6 months interval itself, have to see their doctor, and then further will be evaluated as to what sort of fertility treatment would be required for them. Conceiving itself is a big challenge at the age of 40. It is very rare, hardly 3 to 5%, where pregnancy can be achieved in that age group. And the more challenging thing is at pregnancy, because at this age, the chances of having pregnancy complications is very high. Getting hypertension or diabetes during pregnancy, having IUGR, that is growth restricted baby, or a preterm delivery, or even abruption of placenta, and all these pregnancy complications is very high as the maternal age advances. So we have to have a very drastic approach to such women, where we are anticipating such things, and we have to look out for small signs and symptoms of all these appearing, and then we could probably deal with them in a much better way.